Welcome today. The sun is shining and we are thrilled to be able to be with you. I'm Victoria Schneps, president of Schneps Media, publisher of Dan's Papers, Long Island Press, Noticia, and 75 brands locally. We are so delighted today to have an expert who can help you with your heart and everything you need to know about your heart health. And I think Dr. Duchatellier is going to share with us the kind of power of the heart, even though some other problems come very large in our life. Cancer gets a lot of attention. It's the heart that kills people more than anything. Isn't that right, doctor?
Yes, it is. It is still.
So I think it's the number one.
It is still the number one killer in the United States and throughout the world. Yes, and it's going to be there for a while.
So we are going to have a lot of wonderful questions that we will be asking of the great doctor, and we are going to be beginning very shortly. And we're delighted to have almost 250 people joining us today. Okay. So we have a nice audience of people who want to know more about how to protect their health. And this is being brought to you by Schneps Media. And I'm so happy that this webinar is able to bring such a distinguished doctor to share with us many of the most often asked questions about heart health. So I know it's about 11:01, and we try to give people a little wiggle room to get on board, to be able to plug in get their either iPhones, their computers, however they get onto the webinar, ready to be able to hear Dr. Thierry de Chatelet's beautiful, intelligent, wonderful, powerful information. He is an extraordinarily talented, bright, well-trained doctor and has made cardiology his heart and his life. And so, now he's going to answer those hard thought about questions that you have all brought to us over the course of these last weeks. I think we're almost ready to start. Jennifer, will you tell me when we think this moment is that we can get started? We are probably about a minute away to be able to begin. And we have this wonderful opportunity to be with the doctor and asking and learning questions about our heart. We do have a chat opportunity, so you can press the chat button. And if you want some questions at the end of the session, we will be glad to have the doctor answer the questions so we can be interactive in that way. And then this is being recorded, so it'll be up and running on our website. And we have many opportunities after the fact if you want to share this with friends or family, because I know you're going to be getting some superb information that you will want to keep, look at again, listen to again, and then share on your social media with your family and with your friends. So this is Victoria Schneps, and I am honored to bring to you today Dr. Thierry Duchatellier. Doctor, if you will share with me, I know I sometimes don't have that wonderful accent. The good doctor was born in Haiti, grew up in Dominican Republic, and got his college medicine at Albert Einstein degree. So I am so proud to be here with you. And, would you please say your name properly? So you have that beautiful tilt.
I'm Thierry Duchatellier. I was born and raised in Haiti. High school and college. Did my medical school in Dominican Republic and came to the United States and did my residency and internship, residency and fellowship in the Bronx, Albert Einstein College of Medicine in Bronx, Lebanon, and Montefiore. And I've been in practice for the last 24 years in cardiology, both in Queens and Long Island. And I've been the chief of cardiology at Mercy Hospital for the last 18 years.
So I'd like to ask the first question, and that is, what are the updated 2021 recommendations on how to keep your heart healthy?
That's a very broad question, and I'm not sure there is. The updates are probably relatively unchanged from what it has been for many years. Heart disease remains the number one killer in the United States and throughout the world. When you combine all cancers, it is still the number one killer in women in the United States. And if we look at the population that we are serving currently, the heart disease will remain a significant killer of people. The population is aging. The baby boomers are aging with all they carry with them, high blood pressure and diabetes. And we have currently throughout the United States and probably the world an epidemic of diabetes and obesity, especially obesity attacking the young adolescent and teenagers and young adults. So heart disease is probably here to stay and will have a great impact on our health and the economy of the world. So we look at the risk factors that lead to heart disease. There are modifiable risk factors. These are things that you have ability to control or to modify, and there are non-modifiable risk factors. The modifiable risk factors are hypertension, diabetes, obesity, smoking, high cholesterol, and physical inactivity. These are things that you can control, that you can address through, and we'll go through what can be done with those. The non-modifiable is basically your genetics. You inherit genes from your parents, and if they have a genetic predisposition to heart disease and you have it, there's nothing you can do about this, and there's nothing you can do about age. It's the clock moves on. So
a blessing and a curse.
So we'll leave the genetics apart and we'll leave age apart, but let's attack with high blood pressure. High blood pressure still remains the number one identifiable, modifiable risk factor that that leads to heart disease. Currently, approximately the guidelines have changed recently over the last 2 years. The numbers that used to be given out there have changed somewhat. We're a little bit more stringent as to what is considered high blood pressure. Anything above 130/80 is considered abnormal. So
what is normal? What would you say is the normal range?
Anything 130/80 or below is normal.
Okay.
Yeah. So,
and I also noticed many drugstores now have the opportunity where you could take your blood pressure.
Yes.
But I'm sure you feel that, is it a yearly checkup? What is the best way to have your blood pressure checked?
Well, if you have risk factors for coronary disease or heart disease, and you get your physical exam, and your physician have noticed that your blood pressure is borderline elevated or elevated, it is important to have your blood pressure rechecked periodically. It is an individual suggestion or recommendation. There is not a cookie cutter way of doing it, but I think you have to know the number that you have, what is your blood pressure, and discuss this with your physician. What is the best approach to control that blood pressure? Are you a candidate?
So somebody asked, doctor, it's 130/80 and above. That would be abnormal, because we got a question in the chat room. Is that correct?
Yeah, 130/80 or above 130 on the top number, above 80 on the bottom number is abnormal. So routinely, if you are in the range of 130/80 to 140/90, the physician may decide to modify your diet, put you on a low salt diet, increase your physical activity as much as possible, be more active, lose some weight if you are overweight or obese, and have your blood pressure rechecked. You may not necessarily need medication from the get-go, but if the numbers are much higher than that, then the physician will address dietary changes and weight loss changes, and possibly will start you on a medication that he feels is appropriate for your condition.
So when do you think, at what point do you feel that the medication is something that is necessary? You know, when a doctor says, well, we'll give you medicine. I mean, should a patient say, whatever you say, doc? What would be
No,
a
I
good
don't.
judge for a client?
No,
For
I
a
don't think
patient?
that. I don't think that approach is whatever the physician says is appropriate. I think the patient cannot be passive in this. This is the message. The patient cannot be passive. The patient has to come prepared. The patient has to. It is usually better if the patient comes with questions, already having an idea of what they want to discuss, what they want to know about their blood pressure, their cholesterol, their diabetes, their family history, and what is the plan for them. And so a passive patient is never good. I think we'd rather have an active participant with us. It is a
And
back
how
and
do they
forth.
know what questions, how do they know what questions to ask? What questions to bring? I mean, am I lightheaded? Do I feel what would you, what are the kinds of questions that you would want them to bring with them?
Well, they have to come prepared with the symptoms that they are feeling. For example, if a patient suspects that they have heart disease, heart attack, let's take for heart attack, the symptoms of coronary disease or heart disease is chest pain. Typically, patient will feel a pressure in the middle of their chest. That discomfort can radiate to the neck area or to the shoulders. It is often associated with shortness of breath. It can be associated with sensation of sweaty, diaphoretic, somewhat queasy, and nausea, lightheadedness, or palpitations or pounding heartbeat. That discomfort, those symptoms are clearly urgent and should be a patient experiencing such symptoms should seek medical advice immediately, either call 911 or go to the nearest hospital. But if they have experienced those symptoms temporarily or for a few minutes, they come prepared with the class. This is what I experienced a week ago, 2 weeks ago, a month ago. And the physician will start the investigation, what is appropriate, asking them questions as to what the risk factors is and are, and examination, and will proceed with further testing as the physician feels is appropriate.
So somebody had asked on our chat about an easy or inexpensive, easy to use machine that someone can do at home, or would you recommend they go to a drugstore if they want to monitor, let's say, weekly? They're not going to go to the doctor every week necessarily, or should they?
It's again individualized. I have a group of patients that they're knowledgeable. We teach them how to take the blood pressure appropriately. There is a technique to taking the blood pressure. It has to be done appropriately, otherwise you're going to get false numbers. So yes, for a group of patients, I think obtaining over-the-counter apparatus to take your blood pressure at home is appropriate. I do tell my patient how to take the blood pressure with the machine.
Can you say that? Is it something you could just explain over the video now that we're on this webinar?
I would have to have a blood pressure machine with me to show
okay.
it to you. But
we're not prepared. I'm sorry, everybody.
But again, I tell the patient when they purchase the equipment, keep a log of the readings. Most machines currently store the readings. But the more important part is teach them the right size of the cuff that they have to get. A very large person needs to have an extra large cuff. If you buy the regular over-the-counter blood pressure cuff, it will give you false readings. So you have to have an appropriate cuff size. You have to take the blood pressure in an appropriate setting. You cannot be distracted or talking or having a discussion with the family member while you're taking your blood pressure. You should be taking your blood pressure in a silent environment, comfortable, with your 2 feet on the ground, with your arm at your side, probably your arm around the height of your heart, in a comfortable manner, and take your blood pressure and keep a log. And I tell my patient to bring the equipment with them on the next visit, so I can correlate with the readings that we have in the office. And that's a fairly good way of knowing if their equipment is working appropriately and if the readings that they're getting at home is truly what they are.
Now, I was told once that a woman has different signs of a heart attack than a man. Is that true?
Yes, women are not exempt from heart disease and coronary disease. Um, it is still also the number one killer of women when you combine all cancers. Um, Different than men, the symptoms in women can be very subtle. It can manifest by plain fatigue, unexplained lethargy, fatigue, shortness of breath, some vague discomfort throughout the chest wall, not the typical clutching your chest with heaviness like an elephant sitting in your chest. It can be very subtle. It can be just plain nausea, some mild shortness of breath. So women are definitely different in that sense in their presentation.
What about pain down their arms? Is that something that is different than a man?
The typical symptoms, that typical symptom, the crushing chest discomfort going down the arm is typically a male pattern. Women tends to have more of the discomfort in their shoulder blades, in their epigastric area, can mask as gastritis or acid reflux. Or so women are different in that sense. They don't typically have the discomfort in their left arm, but if they do have it, they should not ignore it. That's a message. They should take it into consideration and definitely seek medical advice as soon as possible.
So when you talked about the blood pressure medicine, the things that are signs that we can affect, are there side effects to taking blood pressure medicine?
There are always side effects. These are pharmaceutical components. They do carry side effects. However, when you look at the literature, the incidence of side effects is minimal. Very low percentage of side effects. And again, this is something that the physician should discuss as to what to look for with that particular medication. And if it's send him an email or a text and say, you started me on this component. This is what I'm feeling. Is that something I should be worried about? Or should I, stop? Should I come back in for an evaluation?
Mm-hmm. One of the people had asked the question about the protocols in terms of blood thinning medications, Coumadin. Are there any other treatments coming up online that you are hearing about for the treatment of high blood pressure?
Well, for high blood pressure, I think we have 40 different medication on the market, if not more, available to us. There are different classification. There are different ways that those medication work. Some of them work by just diuresing you and eliminating the volume of fluid that you have and salt, and will lower the blood pressure. Some others will dilate the arteries throughout your body, the calcium channel blockers. Some of them will block some neurohormones that we have, and others will work on the wall of the arteries to smooth it out and dilate it and lower the blood pressure. So there's different class of medication, and it's not one medication may be appropriate for you and not be appropriate for your siblings, for example. You may react differently to one, and I think it's a discussion that is done with the physician. The physician will decide what is the lowest dose I can give this patient, what is my target goal for that number, what is the blood pressure goal that I'm trying to achieve, and have the patient come sooner. If you're first starting a patient on a medication, this is not a patient that you're going to live in the community and see them 6 months from now. No, this is a patient that comes fairly often, in a few days, in a week or so, to recheck for side effects, laboratory testing, repeat the blood pressure to see if the medication is working, titration of the medication, whether you need to lower the dose or whether you need to increase the dose or add another component, another blood pressure medication.
So a big piece of it, thank you. A big piece of people's questions is always about food, what to eat, how to control your weight, and the other piece being exercise. Is 30 minutes a day good enough for exercise? Are there certain foods I should avoid? I mean, is steak really a bad boy? Should I stick to fish? What are the kinds of things that you have found work for people?
Well, there is no doubt that saturated fats, um, hydrogenated oils, and saturated fats are bad for you. There is absolutely no doubt in multiple studies that have been done. I think we have done somewhat of a disservice by the word diet, and I think we have done a disservice to the population by low fat diet. And you have seen the industry, yes, that decrease the fat in the food that they're marketing, that they're producing, they're packaging. However, they're modified carbohydrate, for example, which are as bad for you in the long run.
So what do you mean by, I
don't
know what that term means, modified carbohydrates. What are you thinking of?
Processed carbohydrates, the cookies, the candy, the soft drinks, all of this, all the breads and all the processed package food that we have available to us nowadays. The desserts, the Twinkies, the donuts, all of these.
So all the things we have to love to hate, guys. We have to love to hate it. But I think, also
yes,
there's a big movement. Yeah. Go ahead, doctor.
So the diet that definitely has been shown to reduce weight, to regress and control coronary artery disease and vascular disease, to decrease blood pressure and possibly help in control diabetes, is a plant-based diet. It is a diet that is high in fruits, in legumes, in vegetables, avoid all animal fats. So it's basically a vegan diet. That is by far the diet that is currently, has shown multiple times, to be beneficial in all facets of heart disease and diabetes.
Well, it's fascinating to me. A dear friend, Eric Adams, is the borough president of Brooklyn, and he was diagnosed with diabetes. And he said, no, I'm not going to just take the medicine. And he went on just what you said. He went on a plant-based diet and a vegan diet, and he lost the weight. And guess what? He lost the diabetes.
His blood sugar. Yes.
And look how he controlled it.
So yes, there is. There is undoubtedly a great benefit in changing the diet from a fatty animal-based diet to a plant-based diet. As far as exercise is concerned, the exercise is individualized. It can be plain going outside and do some gardening, cutting the grass, be more active, going for a brisk walking. I don't think there is a number of minutes that you have to achieve, but we know that if you do 20 minutes minimum a day of any physical activity, you will have beneficial effect of that physical activity. So it can be a gym, it could be anything, any equipment that you want. But if you don't have access to a gym, or if you're afraid of joining the gym, or you're afraid of those equipments and not sure how to use them, and you are concerned about your looks and in front of all those people at the gym, but you can do some exercise at home. We are in the world of the internet. We have access through all different media. How simple exercise, yoga classes, aerobic classes, stretching classes, but we have the best equipment available. We have 2 legs, we walk. And if you do brisk walking 20 minutes to half an hour a day, I think that's sufficient to have a significant benefit in your health.
I think with the COVID now, the need to people fearful of being with other people. What is better? I love your idea of what do we have? We've got 2 legs. Use them. It's so basic, isn't it?
Yes. Yeah,
remarkable.
Use them.
Remarkable.
Yes, it
Well,
is.
so everybody on this, well, you could be seated if you want watching it, but you could walk and watch. One of the things that happens is you don't have to be a couch potato anymore. You can walk and watch. WW, walk and watch.
Yes.
But
Yeah.
it's such a basic kind of no excuses can be had.
Excuse.
So I know that Mercy Hospital is part of the Catholic system that has St. Francis as one of its arms. And St. Francis Hospital and Heart Center has come to Mercy Hospital. So would you share with
Yes.
us what this means to that community in Rockville Center area in the South Shore?
Yeah, the South Shore of Nassau County is definitely welcoming this new idea of having St. Francis Hospital and Heart Center, a great team of renowned cardiologists that have done tremendous work in managing cardiac disease. Now at Mercy Hospital, we have now the capability at Mercy Hospital to do cardiac catheterization and open up your arteries if you're having an acute myocardial infarction or a heart attack. So the ambulances can now bring you at Mercy Hospital, and you will have the procedure done by physicians that are at St. Francis, but established at Mercy Hospital. The cath lab is also backed by the tremendous team of renowned cardiac surgeon anesthesiologists that St. Francis offers. So we have also a team of specialists in cardiac arrhythmias and congestive heart failure as part of that group. Mercy also has access to the wonderful cardiac rehab that St. Francis offers in the North Shore to once you've recovered from your cardiac event, whether it's a heart attack or an angina or heart failure, you can have your physician refer you to the cardiac rehab where you have access to a supervised exercise program dedicated and for yourself. You have access to dietitian, you have access to nurses and cardiologists that can work you through recovery of your.
So, does that mean that there is a outpatient? Is that an outpatient part of the service? We were talking a little bit about St. Francis and the rehab center. Is that all in your home that you are guided, or do they actually have a rehab facility down on the South Shore now?
We don't have the facility is on the North Shore at the DeMatteis Center, but it is part of the concept that cardiac care is now uniform throughout the system. It is the model that St. Francis has wonderfully developed over years of experience. It is the physicians that are renowned that are backing the endeavor at Mercy Hospital. Therefore, I think the population in the immediate area of Mercy and the South Shore of Nassau County should feel confident that they're getting the best care that is available at Long Island. There is no doubt that St. Francis Hospital and Heart Center is a great leader in New York, if not the United States, in cardiac care and other medical territories also. But we're talking about cardiology, so we'll stay with cardiology.
Mm-hmm. Well, I mean, I'm thinking, my husband had the heart valve replacement surgery at St. Francis. Can you do that kind of procedure, or do you go north for that? What is the kind of procedures that, you can do over now at Mercy at the St. Francis Center?
Well, at Mercy, we can do a cardiac catheterization. We can look at the anatomy of your coronary arteries, whether they are blocked or not. We can put a stent into those arteries. We can evaluate for cardiac valve disease. We can determine if you have the need for a pacemaker or defibrillator. We can insert a pacemaker or defibrillator at Mercy Hospital. If you need further invasive testing, such as surgery for your valve or bypass surgery, we have the ability to immediately transfer you seamlessly to St. Francis Hospital and have the team at St. Francis welcome you and take over the care. But the initial, if you're having a heart attack, if you're having an acute episode, you can come to the cath lab, the St. Francis Hospital cath lab at Mercy, and be assured that you will get the best care possible.
We have some people who are very impressed with you, and they want to know, where can they see you? Where is your office? Are you in the hospital, or do you have a private office as well?
Well, I'm part of the Catholic health system. So I am designated to be at Mercy Hospital. So I'm in the grounds of Mercy Hospital in Rockville Center. We are in a building called the Ryan Building, immediately adjacent to the hospital, where we have medical offices. We have in our office, we have laboratory, we have echocardiography, stress testing, cardiac monitoring, but I do general cardiology, basically.
So they can just find you. They can find you at Mercy
me,
Hospital.
They can find me in Rockville Center at Mercy Hospital, yes.
Yes, wonderful. So in terms of some of the questions that came up, there were some questions about the Mediterranean diet. Is that something that you recommend?
The Mediterranean diet has been under some issues recently. When you compare the Mediterranean diet versus the plant-based diet, there is no doubt that the plant-based diet is much more efficacious in controlling some of the risk factors that we talked about. The Mediterranean diet is a very good diet if you're thinking of starting with a weight loss, if you're starting to look at lowering your cholesterol and your blood pressure. So it is a diet that has some component of the vegetarian, but remember that the Mediterranean diet, it's largely oils. It's fatty fish, salmon, tuna, mackerel, sardines, olive oil, and a lot of the vegetables that the Mediterranean eat. So there is some animal base in the Mediterranean diet.
So you feel that potentially it's best to animals should be out if you can handle it.
If you can handle it, yes. So plant-based diet is definitely by far more efficacious. There's no doubt about it. The Mediterranean diet is a good, healthy diet, and it's better than what we are currently eating, definitely. So well, if you can avoid the steaks and the hamburgers and the fried chicken and the chicken fingers and the sausages and the processed meats, for example, animal meats, the bologna, prosciutto, and all of these are extremely bad for your coronaries and for your blood pressure. The Mediterranean diet avoids that part, but it does have animal product in it.
Well, the most popular restaurants today I was at the North Fork table, and what they is a restaurant whose chef uses all the plants locally grown.
Yes.
On the North Fork of Long Island. And this has become a very popular trend. If you just have to ask for it, many menus will offer that, where they are doing the seasonal kinds of foods and doing magic with them in terms of being delicious.
Yeah,
so I haven't found a great vegan restaurant yet. I don't know. I'm not big on cooking, so I would love that would be nice, but I don't know too many. Do you, Doctor?
No, I think we're going to see an explosion of plant-based restaurants and recipes. It's all on the internet, but we're going to see restaurants opening up. I think.
Yes, I see it.
I think an event like COVID has put health in the forefront. I think people are going to start realizing, we need to take care of ourselves. Life is short, and yes, COVID is a different disease than what we are talking about. But I think it's a wake up for us to say we need to be more enthusiastic about life and take life and cherish it, because we see how we can lose the benefit of life very fast if we don't take care of it. So I'm
Well,
hoping that
I know this
an
is
event
not
like
your
COVID,
topic. I know this is not your
will,
topic, but I think that you can't stop but ask about the vaccines. And, you know, you are so respected as a doctor, your opinion about people getting the vaccine.
should get the vaccine. There's no doubt about it.
Okay.
It is my opinion. This is 100%. You should not fear the vaccine. The vaccines have been well developed. Yes, they have been developed in a very fast manner, but they went through all the rigorous testing and scientific research and opinions. I've looked at those vaccines, and they are safe, they are efficacious, and they will protect you against COVID. So I am very pro-vaccine in that sense.
So last
It
night I
doesn't
was
matter
at
which one you get.
okay. So last night I was at a
It
party.
doesn't matter which one. Yeah,
Yes, doesn't matter. Just take it.
yeah.
But I,
Moderna or Pfizer or Johnson and Johnson or AstraZeneca, get the vaccine. The vaccine is better than no vaccine, so get it.
well, I think it's been wonderful chatting with you and being able to share these wonderful pieces of powerful, important information. And I think that we're all better for having heard you speak and share with us how to stay healthy, to cherish life, and to take care of it. We only have one life, right, to lead.
We only have one life, and I think the message is also, don't do it by yourself. Get involved, get family involved, get your partner involved, get your kids involved, do it with a coworker. It's easier to have a group of persons and say, listen, you have high blood pressure also, or you have diabetes. Why don't we go for a walk together a couple of times a week? Or why don't we share healthy recipes that we found on the internet? Why don't we chat and comfort each other? Don't do it by yourself. You're not alone. And it works better if you go back home and you say to your spouse or your kids, you said, my doctor found me to have very high cholesterol or heart disease or diabetes. He put me on this diet. From now on, would you help me? And instead of cooking for you and then cooking for myself and have, why don't we all do it together with some modification? It works much better. I think you spread the health to your family as well in that sense. So,
well, we had a question from someone about cholesterol medicine and controlling that. What is your opinion about that?
Definitely, cholesterol medication is not necessarily for everyone. I think this is again an individualized issue. It all depends on the risk factors of the patient. It is the patient and the numbers and their history and their symptoms and their co-risk factors that will dictate whether the physician should start you on a statin. But there is no doubt that whether he starts you on a statin or not, diet is going to be, and exercise is going to be the biggest component of that treatment. Yes, chemical can help, but there is no significant benefit in having high cholesterol, going every day for a hamburger, and be on 40 milligrams of a cholesterol medication. Because 40 milligrams is not going to work, and the physician is going to have to add another medication for your cholesterol. Whereas if you start with a diet and you start with losing weight and you start with physical activity, you may be able to avoid the need for the statin for that blood pressure, for that cholesterol medication.
Someone asked the question whether you're on heart medication or on statins. Do you, once you're on it, feel you have to take it for the rest of your life, or can you be weaned off these medications?
Again, this is, once you started a medication, this is not necessarily for the rest of their life. There is some exception to that, but again, if you start with high blood pressure and you are 50 pounds overweight and your cholesterol is elevated and you're physically inactive and you stop smoking and you're a smoker, well, if you start by stopping smoking, being a little bit more active and lower your salt intake, lose 15, 20 pounds, whatever it is, 5 pounds is your blood pressure may be able to be controlled with dose modification, and the physician may feel confident that you are a compliant patient, and he may decide to wean you off the blood pressure medication and see if you can maintain adequate numbers with risk factor modification without pharmaceuticals. But again, this is it is, we treat the patient, we don't treat the disease. Everybody is individual. I think that's the concept we should come out with. Everybody's different. So,
well, I think
but the short answer, yes, it is not impossible to take off some patients off medication, depending on the clinical scenario.
so someone had said to me, well, just eliminate everything white from your diet, and anything in your cabinet that has more than 5 ingredients on the box, throw out. What do you think about that?
That's not a bad idea. The simpler the diet, the more natural the food is, the less processed is that food, it is the healthier. There's no doubt about it. We live in a dietary world where it's packaged, it's modified. You read the components of those. I mean, we go to medical school, we go to pharmacy classes doing our medical training, and I can guarantee you, if I read the back of the box, I have no clue what those chemicals are. You would have to Google it, and even when you look at it, the explanation, these are very long, complicated names, and you don't know what their purpose is in a package, basically. But they're there, and that's what we're eating, basically.
Well, I think you have given us enormous things to think about and to act upon, concrete steps that we could take to stay healthy in this crazy world we're all living in. But to our health, to your health, I'm so glad this is Victoria Schneps to be able to bring you Dr. Thierry de Chatelet. Would you say your beautiful name for us?
Thierry Duchatellier.
Where you say it, I just love it. Your accent is so beautiful.
Thank you.
And I'm so grateful to you for sharing with all of us how to protect our heart and how really to protect our lives. Thanks, everybody, for being with us. Bye now.
Bye-bye. Thank you again, Vicky. Welcome.
My pleasure. Thank you.